So my interest in MDS actually came through another way, because I had started the transplant program, the allogeneic stem cell transplant program, in my own university hospital in the Netherlands. So we were the second program, and this is 45 years ago when I started this from our research we were doing at that time point. And so we started treating young patients with acute leukemia, and so we learned how to do transplantation, and we learned from our let's say our complications of our patients and so on. And then we realized that in myelodysplasia there was no treatment whatsoever to cure these patients. And we are a referral center because we are an academic hospital. So we also saw young patients with, so let's say 20 years, 30 years, 40 years, with young children in the middle of their life who had a disease which in the end was fatal, because there was no treatment whatsoever to cure these individuals, in contrast to acute leukemia patients. So, and then I became interested in transplanting MDS patients, myelodysplasia patients with allogeneic stem cell transplantations, and the initial results were very rewarding. This was, the upper age limit at that time was 40 years. So I introduced this to the large community of the transplanters in Europe, the EBMT, the European Bone Marrow Transplant Organization. So I became more or less the founding father of the MDS working group in that society. And so I organized the research in that field concerning transplantation for more than 25 years. And now, currently, I know from the last figures, more than 2,000 individuals, patients are transplanted, individuals with MDS are transplanted with stem cell transplantation in Europe. So that's an amazing. And now the upper age limit, there is no upper age limit. So there are even patients of 75 years of age who are being transplanted with success.